I am talking to you about what happened after I was diagnosed with fibroids up until I had surgery to remove my uterus. Okay, so I found out I had fibroids. This is when I was in the hospital. Right after that, so she did an examination on me and she said that, you know, we're not going to do anything to assist you with these fibroids. We're just going to leave them there and let them be. Mind you, my whole life is being impacted by this. I am very anxious. I am sweating profusely, just uncomfortable in my body. And so I'm like, you know what? That's not good enough. So I got a second opinion and I ran across my OBGYN who performed most of the surgeries on me. This lady, me and her had a great relationship. I knew her was extremely hard for me, kind of made it easier to deal with everything. Mentor in a sense, traditional Western medicine way of doing things to deal with fibroids with women. And so she could only offer me assistance up to a certain point, look up a diet to follow to prevent the fibroids. A lot of fried foods and stuff like that could be a cause of it. I tried to change my diet multiple times. Initially I cut out red meat, chicken, and pork. And so I stopped eating that for a while. And at the time I was living in a place that had stairs. And I realized after I stopped eating the chicken, me going up the stairs, like my knees didn't hurt anymore because my knees used to hurt when I would go up the stairs. And when I stopped eating that chicken, my knees stopped hurting. So I was with my new doctor. We established a good relationship. She was helping me with everything. She did her examination and recommended that I have a myomectomy, which is basically a surgery that you have to remove the fibroids. Instead of removing the baby, you're removing fibroids. Cut to, I had the surgery. And a lot of times when they perform these types of surgeries, there are also diagnostic that go in along with the surgery. So what they do is remove whatever it is that's there, the growths, but then they also test them and they look around to see what else is going on. And that's just like a precautionary measure because you might as well look to see what all is happening while you're in there. So she took out 2 huge fibroids. I can't remember the sizes of them, but all I remember was she told me that one of my fibroids was in the nucleus stage, which means it had begun to rot inside of my uterus, which means I was in a lot of pain when I had a period. And I was also bleeding profusely. A lot of times fibroids, when they grow, they can also grow blood vessels to feed their growth, feed the actual body, the tissues of the fibroid. So it needs blood to stay alive, to feed the tissues, but it grows from the excess estrogen that's within your body. Once they reach the nucleus stage, it is said that they have outgrown the blood supply that they currently have. And so the cells begin to degenerate or break down. When this happens, you get a lot of pain, you have fevers, and I want to say headaches was one of them. But you can always just like Google the symptoms for that. Carrying around these things inside of your uterus, not realizing it's going through an entire life cycle. And that's why you're in so much pain and having such an issue with your period. Thank God she was able to get it out. I was able to keep my uterus, my ovaries, and my cervix. So that was the first surgery that I had, a procedure that I had. So I had a myomectomy also with what's called a D&C, which is a dilation and curette. I think that's how you say that. So this is usually something that you would recognize, like if someone had a miscarriage, they would go in and scrape the uterine lining to make sure that there isn't any tissue that's left there. And the reason why she did this was because when you have fibroids, the fibroids have those blood vessels within them. And they don't, when the uterus contracts, they clamp down on the fibroid and squeeze it and the blood comes out of the fibroid. The concentration should be within your uterine cavity. The lining within your uterine cavity needs to come out every month. But because you had the fibroids in there, they were blocking. It'll clamp down and close the cavity, and so the tissue that's within the cavity won't be able to come out the way that it should every month when you have your menses. And so that's why when I had the myomectomy, she also had to perform the DNC, a laparoscopic procedure to remove fibroids. I noticed the change, you know, like my skin got really bad, I had really bad anxiety, and then I also started bleeding profusely. So that's how I knew that something else was wrong. Went back to the doctor, we did all of our tests. They give you an ultrasound, you also do the MRI so that they can look and see what's actually in there. But I do need to let you know, the doctor cannot tell you exactly what's in there until they go in there themselves. So if you're one of those people that are afraid about surgery, you may want to look in like alternative methods to fibroids. Unfortunately, I was not able to do that successfully. Just know that at least they can go in, see what's happening, run the test to make sure that, you know, it's non-cancerous, it doesn't have any type of serious disease or ailments attached to it, making further decisions down the line based on the information that you get from that. I had the second surgery. It was a success. Unfortunately, she had to leave some fibroids behind because I had that many in there. On birth control. I had been on birth control for a while, but she changed the type of birth control that I had to the progesterone-based way to mitigate the growth of the fibroids, because I was not able to find anything alternatively that was working for me. That's not to say that I did not try, because I definitely tried to find, you know, ways to change my diet, herbs to take, all kind of like exercise, all that kind of stuff. So I was doing that, but unfortunately it wasn't helping. But then also we have to mention things happen because of stress. And when you are in relationships with people that are stressful ailments. So just remember that. I had that surgery, put me on birth control. But at the time I'm like, I just kept bleeding and bleeding and bleeding after the surgery. And I'm like, this is not normal. It must be the birth control, because mind you now, I'm in the recovery stage of this surgery. And I'm waking up every day in pain and like bleeding a little bit. It's not a lot of blood, but there is some blood. When I did that, I just took a risk and I told my doctor, I'm like, although I trust her about my body and what my body is doing and saying to me, birth control, I keep bleeding every day. I don't like it, period. Because I had been through so much prior. The reason why I had to have the surgery, I'm like, I'm tired of bleeding. I'm not doing this no more. I'm checking out of this. So I got off the birth control and just tested it out, and come to find out it was actually the birth control that was causing me to bleed. And so I got off that. I was able to live my life probably for about 4 years after that, because I didn't have the next surgery until 2023. Yes, I said the next surgery. So we are now on surgery number 3. Surgery I had was 2023 summertime. I noticed that I had been bleeding for like a month. Although it was not bad, it's just the fact that I was bleeding and it would not stop. It was day to day to day. Now, this was different from when I was on the birth control, because it was painful when I was on the birth control. But at this point, when I was bleeding, it didn't hurt. It's just the fact that I was bleeding every day. Some days would be worse than others, but it was nothing compared to how I was when I had the fibroids, the huge fibroids in my uterus. So I called my doctor. I'm like, I've been bleeding for a month. I don't know what's going on. I didn't know at the time if it was just me being stressed out because I had moved out by myself to the doctor. Because the doctor that I love, unfortunately, during COVID, she ended up in the hospital with COVID functions to the point where she was no longer able to perform surgery. To retire because she caught COVID. And so I'm left without an OBGYN. And said, if you need an OBGYN, please go to such and such. So she had places for us to go to if we were looking for somebody. And I went where she told me to go because I trust her. GYN, ultrasound, and MRI. 20 something fibroids in there, and they were really small. Doctor that I loved prior put me on the birth control with the progesterone, which is the depot shot. I don't know if I mentioned that she was doing, because had I not been on that, those fibroids would have been huge. So we found out I had like 20 something fibroids in my uterus. She went in, she did a DMC. She also did the laparoscopy, which is, again, they go in with the camera, like a small camera, to look around and see what's happening and remove whatever they can. And so she did that, and she said that, you know, I removed what I could, but it really didn't make any sense for me to go and poke all of these holes in your uterus to remove the really tiny fibroids. And you know, I'm hearing this like, I don't want to be bothered with them because they hurt. Like on the depot shot, which was progesterone dominant, that inhibited the growth of the fibroids that were there. I'm tired of this. I'm tired of getting interrupted, because that's how it felt like. Every time I felt like I was making some strides to like better my life, my situation, I would get interrupted by this health issue about the birth control and depot shot. Progesterone, which I forgot to mention this part, makes cysts grow in the ovaries. So also when she went in and found the tiny little fibroids, that was so many of them, she found out that I had a cyst on my left ovary. I've never had a cyst before. That's not my pattern. Usually my issue was fibroids. Well, clearly that happened because I was taking that progesterone birth control. So I'm like, I need to get off this birth control. Cause mind you, by the time I had gone to the doctor about me bleeding for a month after I had moved out, I'd been on birth control for like 3 years at this point. I've never had cysts before, like, no, we're not doing it. The depot shot, and so I'm like, no, I'm not taking this. And I'm also not taking the estrogen birth control, because that also causes cancer. And so I said, yeah, I'm getting off this birth control. And I just did research on like natural herbs and remedies to assist with like hormone balances and stuff. I'm gonna get this cyst removed, I'm gonna get off this birth control, and then I'm gonna use the herbs as a way to help me stay balanced after I have the surgery, because I was gonna be able to keep my ovaries. Although I was scared and nervous about it, keep my ovaries directly. So I had my fallopian tubes removed within those tissues. That along with the cervix. You can also within those tissues. My fallopian tubes, uterus, and cervix were all removed as a result of this procedure of 2023. So I had 2 surgeries that year. I had the laparoscopic one in the summer and the winter. So, and I scheduled that way because I'm like, I'm tired of having surgery in the summer. It's too hot to be out here like trying to heal from something. I live in Florida. It's too compared to what I was thinking about it, right? So I have a cut here, and a cut where my ovary is on this side, and a cut where my ovary is on this side. That's it. Remove the things that they need to up top, and then they cut the uterus and the cervix out from the vaginal canal and pull that out. Because the first day was kind of a little, but you know, it's the first day, ain't that much. Second day, I was up walking around passing gas because they said you need to make sure that you're up walking around so you don't get blood clots. Like walk around. Any surgeries prior, I knew what to expect as far as like recovery, passing gas, going to the bathroom, like what you need to do and not do. Surgery for me, that has been the worst part. The gas into your stomach so that they can see the organs and the tissues. You have to pass that gas out, because that gas, I don't know what it is about that gas, but that gas hurts. Like the first time I had the surgery, I had gas like in my shoulders. Pills. You can pop the bad boy and fall on sleep. You ain't got to worry about the pain, but it's the pressure from the gas that's annoying. I would say almost a breeze at this point. To my mom's house for like my entire recovery. She took care of me. She did everything I needed her to do and told me to go sit down. I was able to be in a position like that, to be there for me in that way. I do have a code for anyone that's interested in find you a gynecologist or a family practitioner to talk about any symptoms that you're experiencing. Visit. And so if you input the code Tiffany5617, you'll get 10% off your appointment on Doctor on Demand. So enter in the code Tiffany 5617 to get 10% off your appointment on Doctor on Demand. This part 2 of my story about fibroids. If you did stay and watch the entirety of this video, thank you for your time. I appreciate